So we're here to talk about certification and licensure, and I need to ask some questions. How many of you are undergraduates? Okay, and how many of you intend to stay in Wisconsin after you graduate? Okay, so that's important. How many of you are in the mental health concentration? How many are in children, youth, and families? Okay, good. All right, so that'll get us started where we need to be. Can anyone tell me what they think the difference between certification and licensure is? You don't have to know, I just wonder if anybody's got a guess. Yes?
When you're licensed, isn't that when you have the 3,000 hours of the supervision?
In part, that is
part to the certification.
that's a qualification for many social work licenses.
And isn't certification saying that you've been given the information, and licensure is more that you can do it?
Sort of. That's close. That's getting there. What we're talking about is a legal status.
Okay.
So certification is title protection. That means that you can't call yourself a social worker unless you're certified. License is a permit to practice. So you were close. You cannot practice without being licensed. Licensure laws are much tougher, rigorous in the law than certification. So when we're talking about title protection and someone's trying to sue you and you're certified, or you're trying to sue somebody for not being, for some situation that you're in, it's a little bit weaker to be certified than be licensed. But it's not a bad thing. It's just a difference in the law. The reason I asked you that question is because Wisconsin has kind of a hybrid situation, so it's important to kind of know both. I want to give you a caveat before I give you any specific details, and that is that the requirements and things that I'm going to talk about were never made in consultation with the School of Social Work. So the laws were created, the regulations around those laws were created, and then they sort of looked to the Schools of Social Work to deliver it. So they didn't talk to Schools of Social Work, and then afterwards Schools of Social Work kind of had to adjust the curriculums, if they could, to try to make things work. And not all programs in social work can be all things to all people and deliver all areas. So Wisconsin has predominantly two practice areas that we help you prepare for. One is just to be licensed as a social worker or certified as a social worker in the state of Wisconsin. And the other is to be licensed as a, did I say school social worker? To be licensed as a school social worker in the state of Wisconsin through the Department of Public Instruction. And then there's the general social work license and certification through the Department of Regulation and Licensing. Each entity has their own, would you just go to our webpage? Each entity has their own rules. So let's talk about certification and license as the state, not school social workers, just the state. So I need you to think about, Wisconsin's law is kind of a hybrid law. And so when you graduate with your bachelor's in social work, you become a certified social worker. And you become this by filling out the application, paying the fee, and you have to take an open book test on the state laws regarding social work practice. And finally, you have to take a portion of the National Social Work Test that goes along with that level of certification. And this level is certification. So you can't call yourself a social worker unless you're certified. The next level is the advanced level, or those who come up. So you're a certified advanced social worker, CASW, advanced practice, CAPSW. And that means you have a master's degree. So you can't be a CAPSW without it. And it's, again, certification. You can't call yourself a social worker unless you have this level of certification. Same process. If you haven't done it at the BSW level, the open book test, and then the next level exam the next level of exam that goes there. Then, if you are in indirect practice after you graduate, if you don't do direct psychotherapy practice, for example, then the next level is the certified independent social worker. And that's for people who have 3,000 hours after they have their master's degree. And then, again, there's another exam for this. And until a couple of years ago, we had a certified clinical social worker on this side, and that's if you were in direct practice with individuals, groups, and families, doing predominantly sort of more mental health kind of work. But there are certain qualifications for each of these, and when they were always originally put together, if you didn't have what you needed, you could not go to these other levels. That was the first thing. So our school worked really hard with other schools of social work, and we got the law changed so that there are post-degree ways to get whatever you might need. So a door is never permanently closed where it used to be. Now the most recent revision to our law in Wisconsin is these people have been removed from the Y, if you will, and they are now licensed clinical social workers. And LCSW that's a license, so that's a stronger law, and takes it out of the certification realm, but it applies to all these folks. The bachelor's level, just have to have a bachelor's degree, do an open book test, take the exam. Master's level, same thing. Then it's what happens post-degree, 3,000 hours. Now the state of Wisconsin's law says if you want to be a licensed clinical social worker, you have to have completed a clinical concentration. They do not define clinical like you and I do. They do not define clinical like NASW does. They have their own definition. And basically, they say that in school you must have had a clinical placement as defined as doing diagnosis and treatment, not one or the other, not information and referral, not advocacy, diagnosis and treatment, predominantly using the DSM-4 to guide the nature of your practice. And it's got all kinds of words like intrapsychic and so it's really clearly, when you look at the language, what it really defines is what we would think of more as psychotherapy. Mm-hmm. It's really about psychotherapy practice. And from the state's point of view, you know that the master's degree in social work is the terminal professional practice degree. Mm-hmm. So they are very aware that once you have your master's degree, you can go out on your own, hang a shingle up, and have a private practice, right? And they are concerned to protect the public by making sure that people have the qualifications to do that kind of work. Okay, it's really narrow because it's only one piece of what we would call direct practice work. Hospital social work, for example, does not qualify under this definition. Now that's sort of my background, and I can tell you that what I did with patients at bedsides is a lot like what they're talking about, but it does not qualify because we also do things like case finding and linking people with resources and so on that you do in more traditional ways of doing social work. So they really do mean the equivalent of what we would call a psychotherapy practice. In addition, they require that their concentration is this sort of psychotherapy-based traditional clinical setting for your field work. Then you have to have 3 specific kinds of classes. One has to be psychopathology, and has to be done in a school of social work. So any psychopathology course in a school of social work counts. And then you have to have 2 other classes that count towards the clinical, what they call their clinical license or clinical concentration. And we've got a list. And they can be really specific, like population specific, like some social work in youth or social work in developmental disabilities. Group work can count. Aging and mental health. Grief, the grief course counts. There's a bunch of classes that count as the third class. So if you have the right field placement and you have these 3 kinds of classes, then you have completed in the state's eyes a clinical concentration. Now then all you have to do is you work in a clinical setting, continuing kind of that for 2 more years. That's how you get your 3,000 hours. And then you qualify to be a licensed clinical social worker. And you take that test. If you don't have what I just described, let's say you're in children, youth, and families, and you're not in a clinical setting like I've just described, but you know this is early in your career, you might change your mind as to what field you might be in. And now you want to do something more in mental health, in the mental health area, and you want to be licensed. You can still do it. You can come back to school and take whatever coursework you're missing. And instead of the field placement requirement that you didn't get, 3,000 hours is about 2 years full-time work afterwards. You can take a 3rd year. You can take a mental health job for 3 years, and then that 3rd year substitutes for the field placement. And then you can come into this.
That's 4,500 hours.
Yeah, okay. That makes sense. And so that's what clinical means to the state of Wisconsin.